Hello, everyone. I'm Dr. Marty Ross. I think many of you know that. This is another one of our conversations with Marty Ross MD tonight. It's the only remaining way I get to interact with you in Lyme United now, as I'm not answering the questions directly. So I'm glad to see many of you are here. I love interacting with you and giving you my thoughts on things that might move your treatments forward and help you figure out what's going on. So I'm glad to be here tonight with you. The way that these webinars work, we're doing it on Zoom so that we can have live interactions as we need to. But I want you to actually write your questions to me in the chat box. And I take the questions in the chat box pretty much in the order that they're written. Sometimes I'll skip ahead a little bit, but not much. As I answer a question, I'm going to read it out loud so that our viewers on the recorded version can understand what we're talking about, what the question is. And then I'll try to respond to it. I may ask to talk with the person writing that question directly, so that I can clarify a few things. And then after I do answer the question, I will open it up for follow-up questions to that question. So I want to be clear about something. When I open it up for another question, it's not to do a brand new question of an unrelated topic. It's only to be around the topic we've been discussing. Okay, so just to keep that clear. I am creating a recording of tonight's webinar, and so far, at least Zoom tells me it is recording. So we'll find out if it really is recording later tonight when I go to edit it up. And yeah, I think that's what we got here for you tonight. So the other thing I'll ask you, I know many of you have your cameras off. I actually like seeing people, so if you want to turn those on, feel free to. But definitely, when I'm asking you questions, I do prefer if you turn your camera on if you can. I understand you may not be in a place to do that, but I like seeing people too. So anyhow, let's go ahead and get started here. We'll take our first question. Oh, when you do write your question, make sure you're sending it to everyone. I see it looks like everyone's been doing that. The reason like your questions to go to everyone, that means we all can see it, especially as I'm reading it out loud. Okay. All right. So let's go and get started here. The first one is from somebody called Zoom User, which I wonder, is that you again, Tracy? Can't tell. All right. Well, Zoom User. I'll find out here in a minute. My family member who has the three Bs was taking rifampin, clarithromycin, and methylene blue. She had to stop all of it due to severe gut problems, primarily diarrhea, and wants to work to repair the gut before trying antimicrobials again. What would you suggest for a gut repair program in this circumstance? And is there a different protocol that would suggest when she's able to return to germ killing? Who is the person that wrote this question? I really do have some follow-up questions
Yeah.
before I.
Hey Marty, it's me. It's Tracy. I
Oh, I
don't know
thought it was.
why my
Okay. I got
it used to identify me and now it stopped. It has its own mind. I don't know.
it. Anyhow, so Tracy, my follow-up question is, so sometimes it is just your chances increase of getting diarrhea associated as a side effect to the antibiotics the more you put on. Did they kind of ramp up like one at a time, or was it all three at once? And so your family member just had diarrhea out of the gate?
I think they did all three at once.
Okay, all right. So just a couple of things here. So sometimes there's two options that they could consider with their physician. One is trying to restart the antibiotics one at a time and seeing if they can identify if one of the antibiotics as a side effect was giving the diarrhea.
Uh-huh.
All right. Now, I would not ordinarily think of rifampin or clarithromycin or methylene blue giving diarrhea as a side effect, but it is possible. Okay. All right. So
Mhm.
that's one thing to consider. Okay. But even so, even if they were to try to do that experiment, even if it is a side effect, one of the helpful probiotics to use when somebody has diarrhea is Saccharomyces boulardii, also called Sacro B. So Sacro B is a healthy yeast, not a bacteria, but a healthy yeast that lives in our intestines. And if you provide more of it, it tends to help with making your diarrhea or getting rid of diarrhea and making your stools more solid. Okay. And it is possible that if your family member has done some things to deal with yeast, for instance, along the way, whether it's something they're taking to prevent yeast, like herbal yeast preventives or nystatin. Maybe they've knocked down this good yeast, which is not candida yeast, it's good yeast, sacro B. So
Mm.
usually when my patients develop diarrhea on an antibiotic, I like to put sacro B in as one of the options that I'll work with them. Okay. Second thing, and I would probably go with a second probiotic in there as well too. And in this case, I would work with a probiotic that has a combination of a few things in it. I would want something that has something called Akkermansia in it. Akkermansia is a healthy probiotic that lives in our intestines naturally. As we age, it declines the amount that we have there, but it's responsible for producing what's known as the mucin layer, kind of a mucus layer that sits right above your skin cell or your epithelial cells in the intestines. Um, in addition, you would want to find a product that has the Akkermansia and has a number of what are known as butyrate producers in it. And the butyrate made by the bacteria in these probiotics, butyrate heals intestinal cells so they work better, so you get better nutrient absorption, so you have less nutrients sitting in the intestines, attracting water into the intestines, giving watery mush, basically. Okay. In addition, the butyrate producers, butyrate is the key fuel for the cells that line your intestines. Okay. So, a product that is Akkermansia with butyrate producers is a company called Pendulum, makes a product called Metabolic Daily. And that is one I would do at 1 or 2 pills one time a day. So, at a, as if your family member wants to do something to support good gut function, I would do both of those given the diarrhea. And I would still consider doing a trial again to see if you can identify was there one of those antibiotics that as a side effect led to the loose stools, basically. So that's generally what my kind of an approach would be.
Is there any reason to think that switching to an herbal protocol might be better from a gut
Well, yeah, I
standpoint?
mean, so so if this is a side effect of any one of these antibiotics, you can also get side effect diarrhea even from herbal antibiotics, okay?
Mm.
But if this is because these antibiotics knock down too many good um, germs or microbes living in the intestines, it is true that herbal antibiotics seem to have less of a chance of decreasing the germs in your healthy intestinal microbiome. They seem to have less of a chance. And the only reason I say that, I know it's an impression, but I also have some clinical experience that tells me so one form of intestinal dysbiosis, imbalance of the germs that live in your intestines, is if you get intestinal yeast overgrowth. Okay. So Candida yeast lives in our intestines all the time, and it competes for territory with healthy bacteria in the intestines. If you knock down too many of these good healthy bacteria, then yeast will grow too much, right? So in terms of how often would I see somebody on an intestinal or on herbal antibiotics develop intestinal yeast overgrowth? Rarely. It can happen, but it's rare. Versus it was not uncommon in my practice, especially for people that have been on prescription antibiotics for some time, to periodically have to go in and do something about intestinal yeast overgrowth. So that experience tells me that probably prescription antibiotics have put more pressure on the intestinal microbiome, much less so. The herbal antibiotics have much less pressure that they put on the healthy microbiome.
Okay, and would you expect to see, you wouldn't expect to see diarrhea though with candida?
Typically not. Although, I have seen people, not frank diarrhea, I have seen with intestinal yeast overgrowth mushy stools, so there's still some substance there, but I haven't really seen frank diarrhea occur with it. The other thing your family member should look into is if the diarrhea did not stop when they stopped the antibiotics, there's a possibility they could have gotten something called C. difficile.
Mm.
So C. difficile is a bacteria that normally lives in our intestines. And if it grows too much, it will release a toxin, something called C. difficile toxin. Okay, and C. difficile toxin causes your intestinal cells to leak liquid, and you get watery diarrhea. The odd thing is with C. difficile is that it grows when you're on antibiotics. So
Mm.
the rifampin, clarithromycin, methylene blue could have triggered growth of the C. difficile. So if they stopped the antibiotics, the diarrhea is still going, they should get a stool study. It's called a C. difficile toxin. And basically, if all they're going is water, they can send that to the lab too, because they're just looking. It's not a culture. It is looking to see in the liquid or whatever comes out, is there this toxin called the C. difficile toxin? Now, if it is C. diff, they're not going to want to go back on antibiotics, even herbal antibiotics right away. The interesting thing with C. diff is one of the ways to prevent it is Sacro B that I told you earlier. There's some good science showing that Sacro B is a preventive. In addition, it's a useful part of a therapy to stop the C. difficile. But usually, in addition to doing Sacro B, you're going to need to get on a prescription antibiotic that targets C. difficile. Okay. I have a whole article about that. I can show you here in a minute about C. difficile diarrhea if you want to dig into that a little bit more. But I would make sure, talk to your family members, has that diarrhea stopped? If not, before they do anything, they really need to get that C. difficile toxin study done.
Okay, thank you. And there's a product called like Gut Protect C that has some kind of like, I should have probably looked this up, but there might be glycine, or there's certain things that are sort
Yeah.
of there to help sort of rebuild the gut.
Well, sometimes they'll use glutamine, but actually the studies are showing probably butyrate is more important. And a way to do that is just put more butyrate producers in. It's a
Okay.
better way of getting butyrate produced and absorbed than even taking butyrate capsules, for instance.
Okay, you're right. It wasn't glycine. It was glutamine. That is
Yeah,
what I.
yeah. Yeah, so glutamine, the problem with glutamine is it also is used in some I'm going to have this a little bit off, but if you raise glutamine, you can lead to some neurologic dysfunctions as well too. So a lot of us are shying away from using it these days in functional medicine. We're tending to want to restore the gut cells, the health of the gut cells by giving them butyrate. Glutamine inside of a gut cell is a main fuel source, but if we're supplementing it, it can alter some of our neurologic talking of nerves together and lead to some problems that way. And I need to investigate. I'm not remembering off the top of my head the exact mechanism there. So, but a lot of us are shying away from it. We're tending to go more with butyrate and bacteria that produce butyrate.
Mm-hmm. You know what? I think I read that it can turn into glutamate.
Yeah,
Glutamate.
it has to do with glutamate. It's
Yeah,
glutamate toxicity. That is correct. Yeah. Yeah.
yeah. Okay. All right. Thank you very much.
All right. I'm gonna just do a quick screen share here for everyone to show you everyone a couple things. All right. So again, this product that I was describing that has the butyrate producers in it and Akkermansia is this product called Metabolic Daily. Okay. So just to let everyone know that that's the product that has those ingredients in it. Okay. And then in terms of the C. difficile diarrhea, this is my article on C. difficile diarrhea prevention and treatment. And you'll see I list out the antibiotics we use, but then I do talk about Sacro B as being part of a therapy regimen for C. difficile here as well too. And actually, I think I mentioned it in here. It can be used as a preventive. Um, yeah, up here in this part, I talk about Sacro B being used as a preventive for people that have had C. difficile diarrhea. So, for instance, if I've got somebody that had C. difficile diarrhea, I usually will pull them off of their antibiotics for about a month until that resolves. But when I go back on, because I know they're a person that can tend in that direction, I will usually have them use Sacro B, a couple pills, one time a day as a preventive regimen for them. All right. All right. So does anyone have any questions about what we've been talking about here, or should we move on to the next one here? All right. We're going to go ahead and move on. Thanks for that question, Tracy.
Thank you.
Jim, let's see here. Hi, Dr. Ross. Thanks for these webinars. You're welcome. Let's see, I'm dealing with chronic Lyme and Bartonella, and the recent coverage around COVID's fifth anniversary has me wondering what lingering effects COVID vaccines might have on me. Somebody's got his unmuted here, and I'm hearing you. I'm gonna mute. I'm gonna mute that person. All right, got it. Anyhow, so let's see. Thanks for the great webinars. I'm dealing with chronic Lyme and Bartonella, and the recent coverage around COVID's fifth anniversary has me wondering what lingering effects COVID vaccines might have on me. I haven't had COVID as far as I know, but I have had 6 COVID vaccines. Is this likely to cause any lingering problems or things to look out for health-wise in the future? Okay, so I still think we are. I read an article, I think a few days ago, that is looking at what the current science is clear about with lingering side effects or effects of having the COVID vaccines. But I will tell you, what they talked about in there doesn't quite match the full experience of things I'm seeing in people and make me wonder. So Jim, and you and we've talked here a number of times about your lingering problems. I can't tell you whether they're COVID related or not. They don't fall into what I would say the categories of problems that people tend to have. The lingering problems that the science is very clear about right now, probably even from the vaccines, can be heart injury, might be some neuropathies, might be some lung injury. But beyond that, this kind of mess of things that we throw in the grab bag of symptoms called Lyme and Bartonella, it's not clear from any science definitively that that's related to a COVID vaccine. I'm not saying it couldn't be. I'm just saying there's no definition around that right now. Oops, your microphone's off there, Jim.
Yeah, I was really more concerned about the future. Like, I don't know if COVID has anything to do with anything, or but it doesn't really matter to me. I'm more concerned about the future, and if having had 6 COVID vaccines is gonna, like, should I watch out for something? This might cause a problem down the line.
Yeah, I honestly don't know.
What do you think?
I don't know.
Okay.
I don't even know enough to render an opinion to you. I really don't know what if there are going to be lingering effects that are going to come up years down the road. I honestly don't know.
Did you see anything in your patients, that ones who had COVID vaccines, or anything different from anybody else?
No, I mean, there was some stuff that came up right away. I had some people that developed neuropathies. I had people develop some heart injury. The heart injuries were well known. We knew that was a small group of people that could get that. The neuropathies, there was a small group of people that we started seeing around the time we were giving it that would get that. But in my practice, I saw most of the neuropathies resolve. And that doesn't, and I wasn't seeing any after they resolved that we had any worsening come up basically down the road.
Okay, good. Great, thank you.
All right, Jim. You're welcome. All right, I saw a hand up here. Tracy, is that your hand there?
Yeah, I just wanted to say that we had a family member who we were trying to distinguish long COVID from possible reactivation of Lyme. And one of the tests that they did was for a EBV early antigen to see if there was reactivation of EBV. Yeah. And another test that they did was for spike antigen to spike protein. And both of those were high, and they were declared to have long COVID. So if somebody was wanting to, I mean, those might be ways to kind of investigate what's going on.
Yeah. And even though I know that, so having antibodies against the spike protein would suggest the spike protein is still there. That's the idea that they're having with it, but it doesn't prove it is. And having increase of the early antibody for, I'm sorry, was it for COVID you said, or for EBV?
It was early antigen EBV.
Oh, that was EBV. So, EBV, Epstein-Barr virus, monovirus, lives in probably 60 to 70% of the healthy population. And our immune systems are supposed to keep it under control. We cohabitate with it. there is an opinion, and I'm using that word opinion, that if you happen to find this elevated, what's called early antigen, it means that it's reactivated, your immune system is no longer keeping it under control. I don't fully see the science that says that to me, to be honest with you, but it's an opinion. That's why I'm using that word. And there's a theory that for some people with long COVID, the reason that they, in addition to maybe not being able to get rid of the spike protein, and a myriad of other ideas. One idea is that COVID, not the vaccine, but COVID, led to reactivation of chronic viruses like Epstein-Barr. I will tell you the jury's still out on that. I don't think there's clear science that says it's reactivation of Epstein-Barr, but that is a theory that people have explored. Right. Let's see here. And go ahead and move on here. Hi, Melissa. Let's see. Treatment questions. What's the recommended pediatric dose, age 8 to 11 for Lyme Bart, possibly Babesia herbal tinctures and related supplements, methylene blue, cinnamon clove oregano, grapefruit extract, and Lumbrokinase? What would be prioritized for our children, or are the recommendations the same as for adults? Okay, so just quick question. I have an idea what I consider an 8 and 11-year-old to weigh, but can you tell me what do your 8 and 11-year-olds weigh?
Sorry, I was having trouble unmuting. They are on the lighter side of things, maybe 60 pounds.
Oh, okay. All right. So they're, the pediatricians hate what I'm about ready to do. Just, I want to acknowledge that, okay? Because kids are not little adults. All right. That's what they would scream at me right now. I trained as a family physician, by the way, too. So I did a lot of pediatrics. Okay. But when we don't have anything clear to guide us on when things have not been tested for the accurate dose in a kid or even a young teen or a preteen, the best we can do is to look at what proportion their weight is of an average sized adult. Okay, so for the sake of this, I would say we're talking these recommendations I have for people that are 160 pounds or heavier. All right. And then, so what you could do is take any of my recommendations in terms of dosing and have it. Just take it by half. And all the methods that you've talked about here, methylene blue, etc. I don't think I've used methylene blue in a kid before because we started doing it more so around the time I was or I did it for around a year and a half before I left practice, and I just didn't have the opportunity to use on a kid. I wouldn't hesitate to do it on a kid. I just haven't done it, okay? But I would look at the herbs that you mentioned here and Lumbrokinase. I have used those in pediatric populations without any difficulty at all. So basically what I would suggest is following my recommendations, just cut your doses down by half. So, and with the methylene blue, my adult dose is 50 milligrams twice a day. A more gentle starting dose could be 25 milligrams twice a day. So for that one, you might even consider having it compounded as a 12.5 milligram twice a day to start. And if they tolerate that, then go to the 25 milligrams twice a day.
Great.
Okay. Yeah.
Do you think, oh, sorry, I'll just ask, would it be helpful to add the Lumbrokinase in, and would that also be halved basically? So
yeah, to have that one, the capsules are the capsules, right? So you could open them up, or the other thing is, as you know, I try to work to taking a capsule twice a day in an adult. You might, as you start at one capsule every other day, and then see if you can work to a capsule a day. That might be another way of doing that.
Great.
Okay. All right. Let's see. Number 2, what's the recommended duration for Diflucan to treat yeast overgrowth for an adult while simultaneously treating Lyme Bart and focus on Bart? Which is the superior antibiotic to combine doxycycline or erythromycin when both are previously taken? Or would you use methylene blue, never taken? What natural remedies are an alternative to Diflucan? Should they simultaneously be supplemented with Diflucan and continued as maintenance after Diflucan? Okay, so I may or may not understand I'm going to answer, but then let me know if I kind of understand. So if you're looking if they have yeast and you're still trying to cover for Lyme and Bart, Diflucan is a good medicine that will help you with all three: yeast, Bartonella, and Borrelia. Okay, now Borrelia, Lyme. Diflucan is an azole. Azoles are good for growing cyst form of Borrelia. Okay, for Bartonella, we've got lab evidence that the azole family is good against growing and persister Bart. We don't have the persister evidence on the Lyme side. I just want you to know that, okay? But for Bart, you get growing and persisters. And then if you were to try to combine that diflucan with something, you could either do doxycycline or clarithromycin. But if you really wanted to do something that's going to be less inclined to reduce the good, healthy bacteria in the intestines while you're trying to get rid of the yeast, you might go with the methylene blue. And a methylene blue diflucan is a full Borrelia treatment. A methylene blue fluconazole diflucan is a full Bartonella treatment. And then that diflucan is part of a yeast treatment. I usually like to combine my diflucan for yeast with another agent, either nystatin, or I like to combine it with an herbal combination that would have something like garlic in it, caprylic acid, and oregano in it. And the reason you want to combine with nystatin, or that kind of combination I was telling you about, is it seems that yeast have an easier time getting resistant to diflucan unless you have one of these more weaker agents, if you will, combined with it. Okay. And so, for instance, the ingredients I talked about, the garlic and the caprylic acid and the oregano, they're found in a product at my store called Capri Plus by a company called Karuna. All right. That's one way to get those ingredients, basically. All right. In terms of duration, typically treatment that's going to include diflucan to get at yeast is going to take about 30 days. You usually will start seeing some resolution in the worsening of symptoms triggered by intestinal yeast overgrowth beginning about 2 to 3 weeks into that treatment. And then usually by 30 days, 90% of people are done. Sometimes you have to go an additional month.
Okay.
All
That's
right,
shorter than I anticipated.
and then number 3, can BioDisrupt and Lumbrokinase be taken together without affecting their efficacy, given they should be taken away from food and other supplements? So yes, and so everyone, Lumbrokinase is an enzyme that breaks apart fibrin, and fibrin is found in biofilms. Biofilms are mucus polysaccharide slime that have protein skeletons made up of fibrin that hold them together, that cover germs. And then also Bartonella is capable of wrapping itself up in Bartonella, forming something called fibrin nest. And fibrin nest, and wrapped up with these germs, the fibrin nests stick themselves on your blood vessel walls, kind of interrupting blood flow a little bit, but also hiding away from your immune system and the antibiotics too. All right. So Lumbrokinase goes after both of those. But we're now starting to believe that in Bartonella, biofilms are a huge problem. So I'm liking to go after biofilms more strongly than just Lumbrokinase alone. So other things you can do is to use a combination that has a number of enzymes in it that will help break apart proteins and the fibrin, but also have enzymes in it that will break apart the mucus membrane, okay? And then has a number of botanicals in it and herbs in this compound that help block the way that biofilms work. So biofilms, to stick on something, have to adhere to it. There's certain herbs that make it so they don't adhere. Biofilms, to grow, have to sense another biofilm. It's called quorum sensing. And if you can block that quorum sensing, they tend not to grow as well. There are some herbs that do that. Okay. So the product that has enzymes in it and a bunch of herbs in it that will help interfere with quorum sensing and growth and stickiness is this product called BioDisrupt. All right. And so, yeah, you can combine both together. And I have had benefit in doing that. Again, before I stopped practicing, I had benefit in doing that with a number of my patients.
Okay. And can both of those be taken at the same time away from the
Absolutely.
food?
Yep.
Okay. It's so hard to get the timing right of
I know.
not food with food.
Yeah. So the issue with the lumbrokinase is if you and enzymes like enzymes that are in the BioDisrupt is if you have food with them at the same time, they're going to try to digest that food and they're not going to get absorbed to then deal with your biofilm and in the case of lumbrokinase, also your fibrin nests, basically.
Okay. And then just to follow up for the Diflucan. So would you maintain the Capri Plus or a similar herb after you've finished the Diflucan throughout the rest of your Bartonella treatment?
So in terms of treatments, if you've looked at for instance, if you looked at my Ross Lyme support protocol, one of the things I suggest is that you sand something to prevent yeast.
Okay.
And part of your yeast preventive regimen is probiotic, either Akkermansia or a core biotic, a spore-forming probiotic, or
Sure.
this metabolic daily that I suggested earlier, but a good probiotic. And then also sand something to swat down yeast if they start getting more aggressive and a mixture of garlic, caprylic acid, and oregano. The Capri Plus is one way to go about doing that.
Okay, great. Thank you. Appreciate
All
it.
right. You're welcome. Cindy, I see your hand up there.
Yes, thank you. A kind of a question from the previous question.
Sure.
Do you recommend that people do get COVID vaccines? And
That's a hard one. Yeah, I'll tell you my opinion on it now.
Okay.
So, and if anyone wants to groan at me, go ahead. During COVID, I supported getting COVID vaccines, especially the early days, because we had nothing else to stop this thing. And for all those people that became adamant vaccine deniers and everything else, we were at a precarious time. And there is clear evidence, as far as I'm concerned, that those vaccines did prevent a worse situation developing. Okay. So I'm just going to say I will defend my endorsement of COVID vaccines in the early phases, the first year, maybe even 2 years of the of COVID. And if anyone wants to debate me, that's fine, but that's my opinion. All right. But these days, I'm not such a big supporter of it. And the reason is I think that, back then we had nothing. This was an illness that was going to kill everyone practically because none of us had any form of immunity against it at all. Okay. All right. Nowadays, most of us probably have some degree of immunity. It may not be perfect immunity for the exact strain that's wandering around out there, but most of us have some immunity against COVID in general, either because we got vaccinated or we got the infection, or we got vaccinated and we got the infection. So we're not naive to this virus anymore. We have some abilities to defend it, okay? And because of that, and then also knowing that as we're now 2 years, 5 years down the road, 4 years after the vaccine started, there's some questions I have about the safety of this vaccine the more we know about it. And even when I know about it now, I think if we were in the beginning of COVID and there was nothing else we could do, I probably would say get the vaccine. But we're not. We're now further down, and most of us have an ability to defend ourselves against this virus. So I'm not inclined to do the COVID vaccine. The only people that I would say might think about getting boosters are people that have severe immune suppression. And I want to clarify, I don't think that most people with Lyme have severe immune suppression. I do think that people with Lyme, the Lyme and Bartonella release chemicals that make it so your immune system will not do good against those germs, but that doesn't mean you're immune suppressed against all germs, okay? So when I talk about immune suppression, I'm talking people with kidney disease, chronic kidney disease. I'm talking with people that are on steroids chronically for some reason, people that are on chemotherapy agents. Those are the people I'm talking about with severe immune suppression, or people that have are not capable of making antibodies, for instance. Okay, those are the people I'm talking about. But beyond that, I think that most of us, and I'm going against government guidelines, the recommendations of most medical organizations, I don't think the COVID vaccine's worth it anymore. Any follow-ups on that? All right. So let me move on to the next question here. All right. Hi, Chris. See, Chris says, hi, Dr. Ross.
Oh, sorry, I have a follow-up if you want. Sorry.
Yeah, go ahead.
I'm severely injured from the shot, and if you look at, so I'm deep down, been in that for 4 years now. I would ask you to look at react19.org. They have a lot of, they will show you a lot of the medical type things as to what has happened to people with vaccines. If you're interested in finding out more from a different point of view, that's all. Yeah, they're very, very good organization.
Great.
As well.
Great. Yeah. Thanks for sharing that. And again, I acknowledge there were people that were hurt, and I'm sorry that you got hurt by this thing. Again, I'm just looking at back then, that was what we had to use against all the death happening around us.
Right. And I just want to make sure, because we don't wish this on my worst enemy. So I just want to, if people are asking, I just want to let them have an informed choice to look at places. Thank you. Sorry. I hope I wasn't too outspoken.
No, Kathy, that's appropriate. That's very appropriate. Thank you for sharing that.
Thanks.
All right. All right. Let's see, Chris. Let's see. Hi, Dr. Ross. Curious which direction to go. Would these results send you in a different direction, or is there more to explore before putting to bed? Based on just about a fully negative result from IGeneX most exhaustive testing. Second question, is there a surefire Epstein-Barr test out there? One caveat I had, histoplasmosis back in 2012 and did not treat because it was a central mass which dissipated on own and x-rays because it seemed to go away. So your results for Borrelia were you had 2 positives at band 23, 1 genus of 2 was detected. All other tests were negative. The Lyme IgM, PCR serum, and you're telling me all that was negative. So I'm going to clarify something with you. So in terms of what you're saying, your immunobot only showed reactivity against band 23. Is that correct?
Yes.
Okay. So it's not enough based on the test to say that you have Lyme. But let me talk about how you diagnose Lyme. So there's no one thing that diagnoses Lyme. There's 4 things we consider. It's a puzzle, and you have to solve the puzzle. Okay. So in diagnosing Lyme, you try to figure out, is there a risk the person could have gotten? So the greatest risk would be if you live in New Jersey and you got bit by a tick, where 95% of ticks carry Lyme. That's a huge risk. Okay. Another risk is, did you get bit by a tick? Now, some parts of the country, the ticks tend not to carry Lyme as much as other parts of the country, all right? But you're still looking for risk. The other thing are you a person that does risky behaviors? Are you a deer hunter? I mean, that's like the hugest risk in the world. Are you an avid outdoors person going through areas that have ticks, right? So we have to consider, is it possible you got the thing? All right, that's one thing we consider, okay? Number 2, and so if you have high risk, then I consider that like, yeah, that means something to me, all right? Number 2, do you have enough symptoms that look like it, right? And so, the common symptoms, and one way to look at that, there's Dr. Richard Horowitz has something called the MSIDS questionnaire and MSIDS. And if you score high enough on that questionnaire, that means you got a lot of risk as well as symptoms suggesting it. So if you do that, you score high, his positive level, whatever that, I forget what the number is, then I would say, yeah, you got a number of symptoms that look like Borrelia. But keep in mind, a lot of Borrelia symptoms are due to excess cytokines, and other conditions that trigger excess cytokines can give you those same symptoms like mold toxicity and Bartonella and too many yeast living in your intestines. But still, if you've got risk and then you've got a lot of symptoms that look like it, that means something, okay? Third thing we look at is, do you have any physical exam findings? And to be frank with you, most people don't. There's nothing that really says Lyme, except did you have a bullseye rash that somebody saw? Now that's a pretty strong physical finding, okay? Or do you have a lot of red hot swollen joints? That's pretty big physical finding, all right? All right, and then on the symptoms, I gotta tell you one clue that it could be Borrelia is Horowitz, when he designed his questionnaire, has studied the usefulness of certain parts of the questionnaire. If they're positive, does that mean you might have Lyme? Is it as good as a test? Okay. And one of his questions is, do you have wandering joint pain, meaning it's here one day, the next day it's gone? Do you have wandering neuropathy, here one day, the next day it's gone? And that wandering quality he has shown in studies is as useful as a positive Lyme test at diagnosing Lyme. So if you had that test, it's not solely positive, but you told me I have wandering pains or wandering neuropathy every day, I would say, and you have risk of getting a tick, having had ticks bite you, I would say, yep, I'd say I'd diagnose Lyme. Okay, now on the testing front, the test is just another clue. And there are still, even though IGeneX immunoblots are good, they're about 93 to 95% effective at finding a germ when it's there based on their diagnostic standards. It's not perfect, right? And so the problem with people with chronic Lyme, sometimes they have immune suppression so that their immune system is not capable of making enough antibodies that are detected. Okay. The way I would, having said all that, the way I would interpret your band 23 is we're looking to see, do you have antibodies stuck on certain proteins on the Lyme germ? And there are 6 that we call the important ones. Meaning these are ones that if you have an antibody stuck on them, the chances of it being false positive is really low. All right. And we say we want you to have antibodies against 2 of these 6 to really decrease the chance of false positive. And the 6 are 23, or sometimes called 23-25, 31, 34, 39, 41, and 83-93, sometimes called 93. If you have antibodies against at least 2 of those, that's a slam dunk. It's positive. Okay. Now, if you have antibodies against 1, but you got a lot of symptoms and you had your tick bite, then I would call it a weekly. My interpretation is I would call it a weekly positive test. All right. So, in other words, if you're asking me, should you put it to bed? I'm saying, I don't know enough about you to put it to bed, because this could be a weekly positive test. If you have enough other stuff like symptoms and risk of getting it going on, I might call it a weekly positive test.
Understood. That makes sense.
Yeah. Does that make sense to you?
Yeah, totally. I appreciate that.
Do you mind me asking, do you have a number of symptoms that look like Lyme disease?
So no bullseye, no apparent, bite.
Yeah.
But the creepy crawlies of the hot, intense pain in
Yeah.
my joints. Yeah.
Okay. Are
Travels.
you a person that might have run into ticks somewhere in your life?
I'm from Michigan. I'm in construction. So yeah, I'm in the woods. I'm out on the beach. It's,
Okay. You've been up in the Upper Peninsula at all?
no,
Okay.
no.
But in Michigan, it's interesting because if we look at your neighbors, Wisconsin and Minnesota, that's loaded, and by proximity, of course, the UP. And I'm starting to see more and more people picking it up, especially northern Michigan, because I think it's migrating down from the Upper
Sure.
Peninsula as well too. So you're not without risk, especially with your kind
Right.
of job that you do too.
Sure.
In that kind of a situation, if you got enough stuff that makes me wonder from a symptom standpoint, you got this band 23, you've got some risk factors just because of the type of work you do, that you might want to even consider just an herbal antibiotic trial or a prescription antibiotic trial just to see over a 6-month period, does anything get better? Sometimes we'll wind up doing that too. Okay.
That was my question. Is there, quote unquote, an experimental something to take to see if it
Yeah.
triggers a reaction?
You could do like either a doxycycline or clarithromycin just by themselves, not load up with a bunch of other stuff, or herbally, I would probably consider using a combination of like Cryptolepis and Japanese knotweed, those 2, and just do a trial. See, does it trigger a herx, and or does over a 6-month period of time do you start noticing some improvement, not all the way better, but some improvements basically.
Okay.
All
I guess
right.
one quick question.
Sure.
So maybe Lyme,
Mhm.
but do all the other negative tests kind of say, hey, let's not worry about that right now?
The testing says that, but to absolutely tell you negative, I would really need to break apart all your symptoms a little bit more. And again,
Understood.
the problem is with this illness, even though I like Igenics, it can find these germs, 93, 95% of the time when you have them, there still is that 5 to 7% chance that you might have enough immune suppression going on, it can't detect it. So I then have to put on my clinical detective hat, if you will. And
Sure.
knowing your construction outside in Michigan, I would want to look at your symptom profile a little bit more. So, for instance, I think you're probably familiar. On my Lyme information site, there's a whole section I have on how to diagnose. Take a look at the Babesia, how to diagnose, and the Bartonella, how to diagnose. I list out a bunch of symptoms in there that we think are more specific for Babesia or Bartonella. Just see, do you have a number of those? And if you do, then you might want to start thinking maybe that you do have a co-infection, even though the testing is negative too. Okay.
Excellent. Appreciate it.
Yeah. Yeah. Good luck to you.
Thanks.
Let's see, Jim, I see your hand up there.
Hello.
Hi, Jim.
Hi. I have a quick question that actually was back to the previous question, vaccine question.
All right.
What about shingles vaccine?
So I think at this point, and I acknowledge that in hindsight, we're now starting to see a bunch of stuff coming out about the COVID vaccine, which again is why I'm saying don't get it now. It's a different tune than during the beginning of the vaccine, right?
I
The
stopped
shingles
taking COVID
vaccine.
vaccine.
So the Shingrix vaccine, which is the one that many of us are getting now, has enough history of usage that years of usage that I don't see the reports coming of bad stuff out of it. Okay. The evidence doesn't seem to show it is. And the problem is, so shingles is reactivated chickenpox, basically. The older
Yes.
you get, as we all age, we get into something called immunosenescence, where our senescence, where our immune system just doesn't work as well. And the problem is with the chickenpox virus is it lives in us after we had it as kids. And as we get older, as our immune system stops being able to control things as well, it reactivates. And it can be a pretty hellacious illness in an older person. It can
Exactly.
even
That's
leave
why I
you.
asked.
Yeah.
That's why I asked the question.
Yeah. So
And I am an older person.
yeah. So I will tell you, with any vaccine, we're always weighing out risk and benefits. It's always a risk benefit discussion. Okay. And at the beginning of COVID, the risk was you might die if you get COVID. We didn't know enough about the adverse effects back then. Anyhow, that's COVID. Okay. With this one, we know that as you get older, you could get left with permanent damage from pain as it reactivates. And some people even just get super, super sick when it reactivates. So the risk that you have as you get older is,
Friends that had bad situations.
yeah. So you got high risk and probably relatively on the side effect side, relatively safer vaccine. So you have to weigh it out, basically. Yeah, yeah.
Thank you.
You're welcome. You're welcome. Let's see, iPhone 2, and then Trent. I'll come to you in a minute. iPhone 2. What do you got there? Oops, your microphone's off.
Oh, hi, this is Sheila.
Hi, Sheila.
So my question goes back to when you were talking with Chris, you were talking about the Lyme moving, migrating joint pain. Is that because is the Lyme that active that it's moving from joint to joint within
no.
24 hours?
No, it's the symptoms migrate, not that the germ is like here one moment and there the next moment. It's to be honest with you, we don't know why it happens. It is a phenomenon that we see that is unique. We don't think that the germs are migrating from one point to another. They're over your whole body. But as to why one area gets more inflamed and hurts more one day and then another one the next day, we don't know. But that Horowitz, in looking at joint pains, for instance, was able to show, based on the science, that your arthritises that have joint pain, it's always the same place. It doesn't migrate. That wandering quality is very unique, and it's a quality. It doesn't necessarily mean that germs are here one moment and there the next moment. Basically, it's a good question though. Yeah.
Okay, because I was wondering, because it adds to the psychological part of you feeling crazy and trying
Yeah.
to explain your symptoms to MDs of any
Yeah.
sort, saying, well, it's here one day and then it hurts over
Yeah.
here the next day. And
Yeah.
I swear I can feel it moving, but it's.
So I would have to, I'm not sure what, there's a study where Horowitz, I don't know if he published it or he just presented it to us in person, but you might want to Google Horowitz migrating pain and Lyme study and just see if you can find it. I don't know if there is such a study or not, but he's well known for educating us all about that.
I will. Thank you. And thank you for this community, because I've learned a shit ton since I joined a couple weeks ago.
I love people learning a shit ton. That's good. Nice to meet you. All right, let's see. I'm gonna go to Trent next, and then Catherine, I see you got your hand up there too. We'll go to you after that then. Hi, Trent.
Hi, I have learned a shit ton as well recently. My question follows up with Chris about the IGeneX Lyme Immunoblot.
Yeah.
I had the full tick-borne panel done. Everything was negative except for an indeterminate band 31. But I had a bullseye rash, swollen joints, migraine joint pain. I was given a prophylactic dose. I was not given the full tick, 10 to 14. Anyway, so I had all the symptoms. That was years back. I'm now developing neurological symptoms, piecing this all together.
Yeah.
And but I get a negative result with the IGeneX. So I was just curious if like other species could maybe be, or what could have gone.
Yeah, I will ask. I'm going to make another comment. Did you actually see a tick attached when you had that bullseye?
I didn't, but it was immediately following a hunting trip.
Okay, so I would argue with the people that are trying to tell you don't have Lyme, you could have been diagnosed without having testing done. A bullseye rash, well, even CDC criterion says a known tick bite with a bullseye rash and joint pains is Lyme disease. You don't need to even do a damn test for that. Okay, that is diagnostic criterion. Now, I acknowledge you didn't see a tick, but Jesus, you were hunting.
It's been a surreal, yeah.
I would have argued, I would have said, we're not even getting the test. It doesn't matter. I'm treating you. And what they should have done back then is, so many of us now have a standard that if you have acute Lyme, that's what you had, it should have been 6 to 8 weeks of antibiotics. It should have been 6 to 8 weeks of antibiotics. So in your situation, what you just told me, I would treat for Lyme disease. If you're getting neurologic, you got a bunch of other stuff going on, you don't need a positive test. And you may not have positive tests because you have enough immune suppression triggered by the Lyme infection now, or whatever else you picked up there, that that you should be treated. You should be working with a Lyme literate person who can also help you tease out, based on your symptoms, what other infections you might have. So obviously you're not picking it up this way, but you got sick after a bullseye rash on a hunting trip. We know, for instance, on the East Coast, that the ticks out there that carry Lyme, 75% ticks that carry Lyme carry at least one other infection, a Bartonella or Babesia, and 55% carry at least two other co-infections, which could be like an anaplasma, Ehrlichia, or you could have gotten the terrible threes all at once, right? So the fact that you were on a hunting trip, got a bullseye rash, and developed symptoms that looked like Lyme disease also makes me suspicious you picked up something else at that same time. The thing about acute treatment with doxycycline, and I know some of my colleagues try to use herbal antibiotics. I don't do that. I love my herbal antibiotics, but in an acute setting, the science is very clear that we don't have human studies, we have mouse studies. Mouse studies tell us clearly it's doxycycline that stops Borrelia. In addition, although doxycycline by itself would never be sufficient when you have chronic Bartonella or chronic Babesia to kill it, in an acute setting, before it's set in, doxy can wipe those out too. So if they had given you 6 weeks to 8 weeks of doxy back then, we wouldn't even probably be having a discussion about whether you might have Bartonella or Babesia with this too. So anyhow.
Yep.
All
I'm actually in Seattle now. I was bit in Tennessee, but I'm hoping
Yeah.
to see Dr. Iller in a week and a half. So
She gets it. As you know, she was my practice partner, so she
Right.
gets it. So yeah. Good. Good luck
Thank
to you.
you.
Yep. Catherine.
Sorry,
Oh,
is that me? Is that me?
there you go.
Sorry.
Yes.
Hi.
Oh,
Sorry.
I'm sorry. No. I'm trying to talk to Catherine.
Novotny.
Not
Oh,
me.
okay. So
And then Kathy, if you wanted to ask a question, I'd be glad to answer it too. But let me take Catherine here first. Okay. Yeah. Go ahead,
Hi.
Kathy.
Oh, wrong one.
What now?
Which Kathy?
Oh, Catherine N. How do you say your last name?
Novotny. It's
Novotny. Catherine Novotny.
Czechoslovakian.
That's who I'm asking. Yeah.
Yes, thank you.
Sure.
I'm sorry, I have a little echo. It's bothering, but I was diagnosed with RA in 2005, 2006. I found out that I don't have it because I went to a doctor when my other doctor was out of network. Went to Johns Hopkins and they said, no, you don't have it. So I documented like these strange rashes. Half my face will be flush. My hands swollen, red, look like they're burnt, scalded, all these weird stuff. And went to Penn. They thought maybe it was mast cell. And although my tryptase were high, all the other tests were negative. They even scoped me. So I found a Lyme literate doctor and he tested me and it was positive through Vibrant Lab. But I read what you said, you don't care for Vibrant Labs.
Yeah. Let me tell you why. So the Vibrant Labs Borrelia test, Lyme test, is when it is positive, it's accurate. They have validated that a positive test for Borrelia, they've done validation studies on their Borrelia test. Okay. So with independent labs like IGeneX, Vibrant, Galaxy, the only way that you can trust any of their results is if they've done studies to verify that their test is accurate. Where they take samples of blood or urine or whatever sample they want to use, and some of those samples are known to have whatever they're testing for, and some don't. And they're try to see with a validation study how accurate are they picking up the ones that do have it, and how accurate are they picking up the ones that don't have it, and what are their rates of false positives and false negatives. All right, so a lab should do that if they're an independent lab. All right. The trouble with Vibrant is they've only done it on their Borrelia test, and their Borrelia test is accurate when it's positive, but it's probably only useful at finding it when it's there about 60% of the time. Okay. All right. So a negative Vibrant Borrelia doesn't mean you don't have it. A positive one does. But on their Babesia, Bartonella, Ehrlichia, all the other co-infection testing, they've never validated it. And there are so many people I've seen that have come in with Vibrant tests in my office because they came in having seen other practitioners. And I sit down and I start talking with them, and they have positive tests, and I just don't hear the symptoms that say this is probably Bartonella babesia. I'm not alone in this. Number of my colleagues in the iLads community feel the same way. We just don't trust Vibrant labs, basically.
I read where you recommended IGeneX 325 and 335.
Yeah.
So I'm going to ask my family doctor tomorrow.
Sure.
But I do have a Horowitz score of 58.
Yeah, that's high. Yep.
Yeah.
Yeah.
So I'm on the Caldon protocol.
Mm-hmm.
I'm at 18 drops.
Okay.
Of both the Banderol and the
Cemento.
I get brain fog. Sorry.
It's
yes.
Cemento. Yeah.
If this is Lyme, I've had it for 24 years at least. And I lived right near the woods. I had 2 German Shepherds. I used to walk. Took my kids in the woods. So definitely, I live in Delaware. We're very high Lyme incidents. So probably is. But since I was misdiagnosed with the RA, and I was on methotrexate, sulfasalazine, Enbrel, Xeljanz, all that.
You're on immune suppressives that may have made it if you have Lyme, so that's even worse now. Yeah.
Well, and when I was on Enbrel, I had pneumonia 5 times.
Yeah.
That I was hospitalized.
Sure.
So I just feel for peace of mind that maybe I should get the IGeneX test.
I would. I think that's going to give you the greatest chance of finding out if you have it from a lab standpoint. Okay. But also, what you've briefly described here to me, if you have enough, if that comes back negative, but you have enough symptoms, you clearly have high risk. If you have enough symptoms, and you do because you have a Horowitz score of 58, I would also want to tease out, do you have enough symptoms that look like Babesia? Do you have enough that look like Bartonella? You have huge risk because Delaware is close enough to Jersey where 95% of ticks, I haven't seen the Delaware studies, but I'm sure they don't
My husband
recognize
rides
the
dirt
Delaware.
bikes in
Yeah.
Jersey.
Yeah, I doubt if they recognize the border. Those ticks are going back and forth, right? So, anyhow, so I would consider, if you have enough going on, even with negative testing, doing some kind of an antibiotic, herbal or prescription antibiotic trial. But you'd have to find somebody that would do that for you, though. Yeah.
Well, I want to get the IGeneX, like I said, 325, 335.
Yeah.
Being on this for almost a month, I'm still titrating up. Is that going to affect the lab
No,
result?
okay. So your question is, if you're on antibiotics, in this case, herbal antibiotics, does it hurt your ability of an immunoblot, which is the IGeneX 325, 335? That's the Borrelia immunoblot. So again, the immunoblot's an antibody test, all right? And the way that Lyme likes to hide in tissues in the body, and the immune system sees stuff best if it's living in the blood. But if it's hiding in your tissues, sometimes it has a harder time seeing it. So sometimes what we can do, and I should have mentioned this on the first question tonight too, with Chris's question. Sometimes what I'll do with these indeterminate tests is to do an herbal or prescription antibiotic challenge for 3 to 4 weeks and then go and retest again. And Chris, I should have mentioned that to you earlier, but and the idea is when you kill germs in your tissues, the tissues don't like to hold on to dead bug parts, and they release them into the bloodstream, meaning proteins and fats and whatever they are. And the immune system now has a better chance of seeing it and will mount a stronger reaction. So it's a way of provoking a positive antibody test. Okay. So yes. And Chris, same thing for you. I mean, that would be another thought, is to redo it on either a 3 to 4 week either doxychlorothymicin, or you could do a Japanese knotweed cryptolepis and then go and test after 3 to 4 weeks. Or in your case, you're doing basically Otoba and cat's claw. That's the Cemento and Banderol. Yes, after 3 to 4 weeks, it may enhance your ability to get a positive test.
Wonderful. That's
All right.
great news.
All right. Catherine, good luck to you. I'm going to move on to some of the other questions here then too. Okay.
Yeah, thank you. I'm
All right,
learning a lot. Thank you
good.
for doing this.
You're welcome. You're welcome. All right, let's see.
Can I jump in here for a minute? I didn't
Yeah.
know how to raise, I couldn't
Yeah, go
find
ahead.
the hand
Hi, Connie.
icon.
Yeah, go ahead.
Yeah, I'm being, well, I have both Lyme and Babesia. And I've been working with a nurse practitioner to treat both. And I'm curious because, well, she put me on dapsone for the Lyme and it had to
Yeah.
wallow.
Yeah.
And then, and also I've been using this frequency device. It's very complicated. I won't go into it, which seemed to be handling the Lyme. And then the Babesia, all of these symptoms just leapt out. And I'm wondering, what am I trying to say? Does one pathogen suppress the other? In other words, is it kind of like a layered effect?
Yeah. So,
you know what I'm saying?
So Connie, I'm going to answer your question, and then I'm just going to say to everyone, the questions, when I answer questions like this, instead of reading off of the chat box, my preference is to take major questions in the chat box, and the questions that you're asking should only be for follow-up of something we already discussed. Okay, so you're kind of giving me a new question. I'll answer it this one time, but I just want to remind everyone to try to keep the questions, raising your hand, to be follow-up to what I just answered. Okay, all right. To be fair to everyone else that took time to write their questions out, basically. All right. So
Well,
Connie,
I did write my question,
yeah.
but anyway.
Yeah, so here's the deal. When you treat tick-borne infections, it's like peeling the layers of an onion. Sometimes it's, like in my practice, I spend a lot of time trying to tease out based on symptoms, what is there. And sometimes it wasn't clear right away. It isn't until I got a little bit of control of Borrelia that suddenly I started seeing all those symptoms of Bartonella popping up. So that's not an uncommon thing, okay? The other point I want to raise with you is Dapsone in this crazy protocol that Horowitz does called the Dapsone protocol. Dapsone also has some anti-malarial, anti-Babesia properties. So if you're getting or Babesia symptoms, that could be a Babesia herx because the Dapsone is a weak Babesia killer too. So I just want you to know that, okay?
Yeah, well, I've been off it for many months now.
Yeah.
But
Yeah.
I'm on Nepron and azithromycin and hydroxychloroquine.
Yeah, so you're on a Babesia treatment there too then.
Right, but I'm not making as much progress as I'd like to, and I'm just wondering, is there what are the big guns that you would recommend?
Yeah.
Yeah.
So I'll just be very quick with you. For Bartonella, the big guns these days are Diflucan with methylene blue. For Babesia, the big guns are tafenoquine with azithromycin with Mepron or Malarone. That's your big guns there, okay? And I'm giving you the prescription options. And then for Borrelia, I wouldn't say there's any one big gun on that, unfortunately. All right, and then, but if you want to do it all herbal, the big gun would be a combination of crypto, Japanese knotweed, and then a product called liposomal cinnamon clove oregano. Those three things treat Bartonella, Babesia, and Borrelia, and you don't even know if you don't even need to know test by testing you have them. It's covering all three and doing a good job of it. So yeah, okay. All right. I'm going to move on here. Good luck to you, Connie.
Thanks.
All right, let's see here. All right, Teresa, let's see. Hi, Marty. I've had the 3Bs for at least 6 years. My symptoms lead me to diagnose neuroborreliosis. A new doctor recently prescribed rifampin 300 BID for 2 weeks. I think either my immune system is shot and I had my first cold in years, or had lots of side effects. Flu-like symptoms, runny nose, rigors, chills, cough, total weakness, profound fatigue, off balance, bloating, gas. But the prescriber said I was herxing and prescribed 2 more weeks of it, and I could call him if I need to see him again. He would then consider ordering Vibrant Labs to see what species I may have and also consider SOT. I'm not sure those ideas are in line with current treatment. I don't think rifampin agrees with me, so now I'm considering treating with Cryptolepis, BioDisrupt, possibly add back methylene blue while I seek a Lyme literate provider. Any thoughts? Yeah. So SOT, I have a whole article where I basically call SOT a scam. So we're already at 7:09 here. I would urge you to go to my website where I explain that I think it's malarkey because there's no science behind it. There are a lot of providers making big money offering this, and much to my chagrin, iLads even offered a training in how to do this. And so now because iLads offered a training, it looks like iLads endorses this type of therapy that has absolutely no science behind it and every reason to believe it's a scam. Read my article. I won't, I'll get off my soapbox, but read it. The article's very clear why I don't agree with it. Okay. Vibrant Labs, you already heard my opinion on Vibrant Labs. I wouldn't throw your money away on Vibrant Labs. And then, but if you're looking for an herbal way to handle the 3Bs, I would look at that combination of Cryptolepis, Japanese knotweed, the cinnamon clove oregano, and the BioDisrupt. Oh, I see you want to add back methylene blue. You could do a knotweed crypto. Actually, if you're going to put methylene blue in, you could just do a crypto Japanese knotweed and methylene blue and not do the cinnamon clove oregano. Those two would kind of substitute for each other, the methylene blue and cinnamon clove oregano. That BioDisrupt, as I explained earlier, has a number of herbs in it that alter quorum sensing and its stickiness of biofilms. and also a number of enzymes in it that break down biofilms. So that would be a good product too. So if I were to suggest something, don't throw your money away on Vibrant. Don't waste your money on the SOT. And if you're wanting to do a mix of herb and prescription, methylene blue along with crypto, Japanese knotweed, and throw in your biofilm breaker here, I think would is a reasonable thing to look at doing.
Yeah, I had that feeling. Yeah, because there was no recommendation of a biofilm buster or anything. So
yeah.
And then is it possible to have such strong reactions to rifampin?
So that when you throw rigors in, I have to wonder if you were having what's called a drug reaction. So if you get, there are some drugs that we can develop an autoimmune reaction. Our immune system literally attacks that antibiotic. And when that happens, you usually get a drug fever. To amount to your body to increase its temperature is going to go into muscle spasms or rigors, shakes to generate muscle action that drives your temperature up. So I don't know if you checked your temperature, but if you were having rigors, that kind of muscle shakiness and frigidity, you feeling cold, meaning that you probably were developing a high temperature. So just what you said here makes me, and I know rifampin is one of those drugs that can trigger what's called a drug reaction. Yeah.
Yeah. Okay. Thank you.
You're welcome. All right. Did anyone have follow-up questions to that? All right, let's get moving here. Hello, Rhonda. Let's see. How do I keep my blood sugar from dropping when I fast? It never tests as low, but I get shaky, weak, crazy, and anxious. Wow. So I don't have a good response to you on that one.
I'm sure it has something to do with the Lyme.
Well, maybe, but the other thing it might be happening, and I have seen this happen a number of times. So I once had a patient that had really bad Bartonella, and before she came to see me, she was being treated for hypoglycemia. And when I saw her, I just took my initial screening, and I always try to screen at the first visit to make sure people don't have intestinal yeast overgrowth, right? And her score on my intestinal yeast overgrowth screening questionnaire was off the roof. She also had pimples and acne. You'll see that a lot. Yeast in the intestines, the imbalances in the gut microbiome leads to skin issues like pimples and acne. It's not that yeast is living on your skin, but it's just a manifestation of an unhealthy gut, okay? People that have hypoglycemia, yeast overgrowth can lead to hypoglycemia. So what you might want to consider doing is look at my article. It's called "Is It Yeast?" I'll show it to you in a minute. And then,
Well, I can tell you, not to interrupt you, but
no,
I'm
go ahead.
positive I have that. I put another question in there because I had to go get Mary's magic potion today because my mouth is really inflamed. I have Sjogren's too, but I get this it just burns and my tongue is really white though. But I have little bumps all over my back. It's really itchy and on the sides of my arms. So my other question was I have some really old Diflucan and I probably shouldn't have it. I shouldn't be telling you this. But anyway, I took one today and there's like 20 in that bottle because my doctor, functional doctor about 4 years ago had me take it for like 6 months.
Sure.
But I don't think I ever got rid of this problem.
Right. So you may not have. So what I want you to know is every time, so throughout, and we want to eventually turn into her tick-borne illnesses, but once we cleared yeast out of her hypoglycemia was gone. So the reason I focused on that might be the issue for you. It might not be true hypoglycemia. It may be hypoglycemia triggered by too many yeast. And if you clear the yeast, you might be able to start doing fasting, basically. All right. Yeah.
Okay. Okay. All right. And what's the best thing that you can take for the yeast? What do you recommend for that?
In terms of just general recommendations, so my starting point usually is 30 days of Diflucan at 200 milligrams one time a day, coupled with nystatin, 2 pills twice a day, which is a prescription also, or an herbal combination that would have caprylic acid in it, garlic, and oregano. Those ingredients happen to be found in a product called Capri Plus by Karuna. And you would do that also as 2 pills twice a day. So Diflucan for 30 days, 200 milligrams, 1 time a day, coupled with either the herbal combination I just talked about or the nystatin. That will work 90% of the time in 30 days to clear yeast. If you are really loaded, though, sometimes you have to go 2 months, actually. Okay. All right. The other alternative would be to do just the herbal combination I talked about. Oh, do probiotics, by the way, too. Don't forget to do your probiotics. Okay. But it would be to do the herbal combination I talked about, and it would, in over 2 months, that along with your probiotics would give you a 85% chance. So your best bet is the Diflucan with nystatin or the Diflucan
Okay.
with the herbal combination. Okay.
Okay, thank you. And just really quickly, so I have the full script account, and in there I have that the one that's the pro that you mentioned it earlier. The MB, no, I'm sorry, that's methylene blue. What you mentioned earlier, I don't remember the name, but it was probiotics, and
Yeah.
and there's a pro,
It's a
and that's what I have.
so yeah, so there's a product, Pendulum makes a product called
Yes.
Metabolic Daily, which you don't need to have full scripts account to get, but then they get full scripts on board. They came up with something even a little more powerful called Metabolic Daily Pro. To be honest, just the regular
Not
Metabolic
necessary.
Daily is going to work, which you
Okay.
can buy. You can get it from me, or you can get it out there from anyone. The Pro is just the same product. It's got a little bit more of stuff thrown. It's got more cultures thrown in, basically. Yeah.
Okay, well, I have that Capri Plus too because I did read some of your stuff, and that's
Yeah.
where I got those two.
Yeah.
But I'm not sure if the full script has the plain one. That's why I wondered if the pro was okay to take. But I get 30% off in there, so
Yeah,
it's
yeah,
a little
yeah.
bit
No,
cheaper to
no,
get it.
you could do the Pro. Basically it's got more cultures of the butyrate producer, the 4 butyrate producer bacteria that are in it, and a little bit more live cultures of the Akkermansia that's in it. It's just there's more packed in a pill, basically. You can
Okay.
easily do that. Yeah, yeah.
Okay, thank you so much. And if you see the rest of mine, you can just pass them
All right.
because I think they're coming up. Thank
That's good.
you.
That's good. Chris, I see your hand up here.
A super quick question about nystatin. How good or bad is it when you have leaky gut?
Are you saying is nystatin alone good enough for yeast or not? I'm trying to clarify your question.
I guess both now that you ask. Is it good
Yeah.
for the yeast? And then, how
Yeah.
detrimental would it be to my leaky gut? Because I definitely have that as well.
Okay, so nystatin by itself is not the greatest yeast killer if you have active yeast overgrowth. And if you've got leaky gut, I wonder if you have active yeast overgrowth. Okay.
Right.
And so I would want to couple it with something else like a Diflucan, basically. It's not strong enough by itself to get rid of yeast. Now, if you have leaky gut, I don't see harm of the nystatin getting absorbed into your bloodstream and hurting you anyway. I've used tons of nystatin on my people with yeast that just by definition, yeast overgrowth probably means you have leaky gut. And I've used tons of it. And even though it's not supposed to be absorbed in a healthy intestines, I just saw no evidence that people were getting harmed in any way of being on nystatin, even with a leaky gut. I don't see that clinically, I don't see that there's absorption of nystatin with leaky gut, if that's what your question is. Yeah.
It is. Thank you.
Okay. Hello, Mark. Let's see. Thanks for all you do. You're welcome. I see these are my most recent results. IgE greater than 1200, IgG 25.88. I was tested for mold, Great Plains, a couple of years ago, but the results were below the threshold. That said, my physician wants me to start treatment for high cholesterol. Should I ask them to prescribe cholestyramine? I recall this having been used as a biter and mold treatment. Should I be tested for parasitic infections? If so, can you recommend a specific panel or lab? Any other suggestion? Greatly appreciated. All right. So is this, I just want to clarify, Mark, is this just a general blood test for IgE, or is this an IgE level against a certain thing, like against mold? Did they tell you that? Well, Mark, I can't answer your question without more information. So if you're not here right now, I'm going to need to move on to another question here. All right. All right. Hello, Trent. Let's see. Dr. Ross, I recently tested positive for 4 or 5 mycotoxins in real-time labs urine test. For reference, I have moved 3 times in 4 years. We recently disposed of an espresso machine that had a substantial amount of mold. How common is it for patients to have 4 or more positive mycotoxin types? Does this tell us anything about potential colonization? And then you have highlighted the risk of PICC lines in the former Q&As for those diagnosed with Lyme, neuroborreliosis, moderate neurologic symptoms building over the last 3 years. How would you weigh PICC versus oral antibiotics? Okay, I'm going to start with your second question. Oral antibiotics can work quite well for neuroborreliosis. I rarely use IV antibiotics in my practice, rare. The only time I would do it is if I had somebody that had such severe neurologic side effects and they were rapidly declining, I might go ahead and put them on IV in that situation. But most oral antibiotics, actually, even though the studies would say maybe they don't do the greatest brain penetration, they do. Doxy does good brain penetration. Your macrolides, I could list them all out. They all seem to do pretty good brain penetration. So I would probably shy away from doing PICC. And I think there's a lot of risk against it. And I think most of us these days, most Lyme literate docs these days are just going all oral. It's rare most of us do anything IV anymore.
Okay.
And then in terms of the mycotoxins, the more toxins you have means the greater that your risk was you were exposed to a contaminated building somewhere along the way. So a contaminated building is not usually going to have just black mold. It's going to have other molds that give toxins, all right? So the clearest thing I can tell you is you've been exposed to mold.
Yeah.
The second part to your question is, are you colonized? I can't tell you for sure. All right, so let me break that down. All right, so when you have mold toxicity, basically what's happening is that your body is incapable of breaking down mold toxins that are in there. All right. And that is a situation that happens in about 25% of us are programmed in a way that our immune system doesn't do its job and doesn't break down mold toxins. In 75% of people, when you breathe in a mold toxin and through the lungs it gets absorbed into your bloodstream, our immune systems will make antibodies against those mold toxins, and then these toxins with antibodies attached will then attract other immune cells that will break down the mold toxins completely, and they're broken out of our body. Okay. All right. So 75% of us have immune systems that make antibodies that work correctly, that destroy mold toxins. All right. But 25% of us don't. And so those toxins, basically, the liver doesn't handle them well. It doesn't detox them the way the liver does other fat toxins. And these toxins eventually get excreted through the bile system out into your intestines, where because they're fat, they get reabsorbed again. So you get this endless loop. Okay. All right. Now, there is a small percentage of people with chronic mold issues that when they were living in their building with mold, inhaled the spores, and those spores got colonize your passages and maybe even your intestines. And it isn't like a fulminant pus-filled infection. It's just a small amount lives there, and they become a brew pub, and they can produce the toxins. All right. Now, we do not have a test that tells us if you're colonized. And the reason is probably all of us in our mucus are walking around with some mold spores, because our mucus is designed to catch this stuff, okay? And so the question is, do you have too many mold spores? And we don't have a test that does that. All right. Now, in my experience, in my practice in Seattle, Washington, I never started out by treating people for mold colonization. I did not put them on mold spore killers at first. All I would do with mold toxicity was put them on binders, and then in about 4 to 6 months, come back in and test again and see either clinically are they getting better or are their tests improving. And if it looks like by 4 to 6 months they're doing better, I would usually not put those patients on antifungals to kill mold spores. And in 90% of the time in my practice, I never treated for mold colonization. All right. Now, I know there are some providers out there that the minute they see you have mold toxins in your urine, they're throwing you on itraconazole, silver nose spray, amphotericin B to treat you for colonization. And I think they're overkill. Now, the person that I think has a reason to do that would be, you're probably familiar in the world of mold toxicity, there's a practitioner named Neil Nathan. Now, Dr. Nathan attracts people that have failed treatment. And it makes sense for him and his practice to start thinking they're probably colonized, but he has a different population than the average person. So in my experience, and I know Dr. Krista is another doctor that talks in the mold space quite a bit. She doesn't put people on antifungals right away. She works with binders first, even 6 to 9 months, and sees where she gets first before she starts thinking she might need to put them on something to treat for colonization.
Okay, and then what did it look like necessarily with Lyme and mold simultaneously in terms of treatment? Can you treat those simultaneously?
Absolutely. So in my protocol, one thing you'll notice in my protocol, I say, if it looks by your history, if it looks like you got sick when you were obviously exposed to mold, go after the mold. You may not even need to treat for the tick-borne infections, because even though you may test positive, it really may be that your immune system dealt with the tick-borne infections, but the only problem is the mold toxicity. So let me give you a clear idea what I mean by that. So I had a patient that came to see me that was sent over by a naturopath in town because he had severe neurologic symptoms and positive Lyme testing. And he was told he needed to get on IV antibiotics right away or he was going to die. Honestly, that's what he was told. And so his mother brought him in. She's a nurse, and she thought that the naturopath had been a little extreme. And so I sat and talked with them, and I said, "Tell me your history." I always take a history. "Tell me your story." And basically, he says, "I don't remember ever getting bit by a tick bite." And I said, "Well, tell me about like where you were living when you got sick." He goes, "Oh yeah, I had just moved into this house. And we soon discovered that there was an aquarium that had been kept in the back by the previous owners, and there was black mold all over the walls." And I said to him, I said, "So when did you get sick?" He goes, 2 weeks after moving in. So anyhow, if you have an obvious story like that says it's probably mold toxicity that got you sick, right? And then I had a number of stories that basically in those situations, what I would do, even though they have positive testing, keep in mind, mold toxicity symptom-wise and chronic tick-borne infection symptom-wise can look the same because they both trigger your immune system to make too many cytokines. And it's too many cytokines that give you this symptom mess, okay? So if the history says maybe there's something that really juiced up the cytokines and caused it, you go for that first. Now, if the history is not clear, usually what I would do is I would start treating for tick-borne infections, and after a person is stable on that in about 2 to 4 months, then I would add in my treatments for the mold toxins. And the reason is when you start pulling out mold toxins or you start killing tick-borne infections, you're going to trigger cytokine surges. You're going to get worse, all right? When we cause a cytokine surge from killing germs, we call that a Herxheimer reaction. We don't technically call a cytokine surge from pulling toxins out a Herxheimer reaction. Herx is only for killing germs, but same idea, right? So I usually I don't want to wallop people too hard with cytokine surges. So usually when it's not clear to me what came first or whether they're both contributing, I'm going to start with my tick-borne infections first and then come in and add in, taking simultaneously, binders and the things we might do for mold toxicity.
Great. Thanks very much.
You're welcome. And then I know we're running out of time here. I'm going to take one more question, but it's going to be iPhone number 2 again. And I know you told me your name and I'm forgetting, but go ahead.
Sheila.
Sheila. Hi, Sheila. Yeah.
Thank you. So it was just a follow up on what you were saying for clarity. So in regards to mold toxicity, if you're treating yourself with the crypto, Japanese knotwood, say cat's claw, and the other one, and taking a binder, would that be sufficient enough to remove mold colonization, assuming it's a long enough lengthy period of time?
So it's not, so I want to just use terms here clearly. Okay. So colonization means you have spores in you that are producing the toxins, and therefore they're in you as a result of that, versus versus mold toxicity means you also have toxins in you. They're two different things. All right. It's just that colonization can become your production factory for the toxins, especially if you're having a hard time getting it out. It might be your binders are working, but you're not getting better because you're living in your own swamp, basically. Okay. Does that make sense? All right. So the majority of people don't ever have to take an anti-fungal to treat spores because they're actually not colonized. They just have a swamp that they need to use binders to get out. But at a point, if binders themselves are not lowering your toxin loads, then you got to start wondering, are you also colonized? And in addition to removing the swamp, you need to start killing the spores so they don't keep contributing to the swamp, basically.
Gotcha. Okay, perfect. That was
All right.
Perfect clarity. Thank you.
You're welcome. You're welcome. All right, everyone. That's it for me. And I know I got tons of, you guys write a lot of questions, and I appreciate that, but I think you see how this works. We go off in one direction just based upon one answer. So anyhow, I'm glad to see everyone was here tonight. I look forward to helping you again next week too, and seeing you next week. And then look at sometime around 8:30 to 9:30 in the morning, I will post up in the Zoom recording space the recording of tonight's webinar. Okay. And as you know, yeah, I try to create a brief summary of that goes with that too. Yeah. Who was saying something?
Sorry, I'm new here. I just want to ask a quick question. If I have results from a test, like an Armin test, is there a place I can send them to you for you to look at, or no? Or how does that work? Sorry, I just don't know how that works.
No, I don't do that. But if you want
You
to
don't?
raise it here next week on the webinar, I'd be glad to take a look at it that way.
Okay, and like, would I take a picture of it, or how would I show it to you?
You can actually, that's true. That's a good problem. You would, there's two ways we could do it. One is you could write out the results as a chat, or you could turn your camera on and we could look at it with your camera at the same time.
Okay, like I could just, instead of looking at me, I could point my camera at it for you that way? Okay, thank you so much. Sorry, I'm new and I really appreciate it. It was very good today. Thank you very much.
You're welcome. Glad you're here. All right. Bye, everyone.